I went to school, an undergraduate at University of Colorado in Denver, and went from there to Temple Medical School in Philadelphia. After that, I completed my residency training in family medicine at Lancaster General, which is in Lancaster, Pennsylvania. And after completing that, I actually entered the Navy while I was in medical school, and then the Navy told me I would be going to Jacksonville, North Carolina. Sovereignly ordained, I believe, and came here approximately 18 years ago now. Active duty initially for 3 years, and then came out into town here with another practice, and then eventually came to join Wilmington Health now about 7 years ago, I believe. I have 5 children. I'm married happily with 5 children. I'm actively involved in my church as an elder there. I like to promote what I preach. So healthy eating and exercise are important not only from myself, but my family as well, and my patients. Well, everything I think in my practice is relational with my patients, and that's probably the most important thing, is that we develop that relationship. And in getting to know a new patient, whether it's a pediatric patient or whether it's an adult patient, is not only going through their medical history, but also asking some questions and just getting to know them a little bit better, and that they feel a little bit more comfortable with me through that interaction. So that's going through their entire history, and as I've made note before, I'm also interested not only in their medical history and who they are as a person and what their family is like and what their job is like, but also in their spiritual health as well. That's something I like to talk to them about if that's an interest for them. Well, number one is probably, why did they come see me in the first place? So if there's a specific problem that the patient has, I want to make sure I've addressed that and they know what the plan is by the end of the appointment. Number two is in their discussions of their past medical history, looking at preventative health issues with them if they've let those things fall by the wayside or things that we need to readdress on those. I always want to make sure we're looking at their health in front of me there, which is everything from their vital signs and their weight. And in the population that we deal with, unfortunately, there's a lot of times where I have to I always bring up the weight and talk about how have they dealt with that and what can we do for probably 70% of my population who are overweight or obese to get them back into a healthier weight. So whether a new patient's coming in who is a pediatric patient that's overweight or obese, or whether it's one of my geriatric patients that's overweight or obese, or anybody in between, there are definitely health risks associated with that. And when I look at the patient and talk to the patient, whether they're 5 years old or whether they're 55 or 85, I say, my concern for you is your long-term health. And I look at them and I say, I'm not saying I don't use words like fat or anything, but I said, where your weight's at is not the best for your long-term health. And I want what's going to be best for your long-term health. So I said, what I'd like to do is let's formulate a plan of how we can come together on maybe getting the weight to a healthier weight, where I'm not going to be concerned as much for your future of your health in regards to all the risks that can come with this weight. And they may even have some of those problems already from the weight, and if they do, we want to reduce those and get those improved. And number two, if they don't, then I'm going to say, here's all the things that this weight is associated with as a risk. And I'll say, where your weight is right now, here's where the risk for these things is right now up here. If we can drop your weight to a normal weight, the risk for all those things falls way down here. So I'm looking for really, in their medical health long-term, the best health that they can have long-term, and that's going to involve, to some degree, usually getting their weight under control. When I first was told I was coming here, everybody gave a lot of negative comments about Jacksonville. What I've found is, since I've moved here, for me, having my family here as a place that is great for raising family, I think it's fantastic. As a place where I'm involved in my church and the community and being able to support the community, it's fantastic. One of the nicest things is being here in this community, which is a lot of dependent military people as well as retirees. And we can still provide great care to people who really deserve great care. That's one thing I feel is a calling for me here too, is being able to provide hopefully quality care to military dependents, families, and the retirees.